Signing up for Medicare can be very confusing, so I'm going to try to explain it, simplify it on one page on the chart that you see behind me. When you sign up for Medicare Parts A and B, that's the beginning of the process, and you, the Medicare beneficiary, has to be the one that does the sign up, not your agent, not somebody else. And you're going to do that sign up through the Social Security website, ssa.gov. Now that may sound confusing. Why are you going there if you're getting Medicare? But think of the Social Security Administration as Medicare's administrative assistant. You go through them to sign up for A and B. And the first thing that you're going to want to do is create a My Social Security account on ssa.gov. That way you get verified and you will be able to do an online application for Medicare. So the question is, when do you do this? When do you submit an application for Medicare? First of all, there are other ways to sign up. You don't just have to do it online. If you're somebody that's not great with a computer, you can call Medicare, the SSA, and get a phone call set up for the future, and they can do your application over the phone. Sometimes you can go in person to your local office, although I'm hearing maybe not so much recently. So in the meantime, when do you sign up for Medicare? If you have never been on Medicare, there are 3 distinct periods of time where you can do that sign up. The first is your initial enrollment period. The second is a special enrollment period. And the third is a general enrollment period. So you see up above those letters that I've written. So let's talk about each. Now, before I get into it, if you happen to be taking Medicare, I didn't mean Medicare. If you happen to be taking Social Security 6 months before your 65th birth month, you're going to be automatically signed up for Medicare. And at that point, you have to decide, are you going to keep it or are you going to reject it? And it wouldn't begin until your 65th birth month. So let's first talk about your initial enrollment period. That's your first opportunity to sign up for Medicare based on turning 65. It's a 7-month window surrounding your 65th birth month. So 3 months leading up to it, your birth month, and 3 months after it. If you sign up, submit an application during any of those 7 months, you will be signing up for Medicare timely. You'll get Medicare Part A and Medicare Part B by taking these steps in this process. If, however, in the alternative, you're still working and you have group coverage and you have a company with 20 or more employees, you may consider delaying Medicare. So if that is the case, and by the way, you don't have to let Medicare know if you're not taking it, but if you decide you're going to continue to work and you have had continuous coverage of insurance with your company, group insurance, then later when you do decide to enroll in Medicare and retire, you'll come in through a special enrollment period, again, through the Social Security Administration. And I will tell you that a lot of people that don't take Medicare during their initial enrollment period still sign up for Medicare Part A. But I don't recommend that you do that if you are contributing to a health savings account. But if you are not contributing, you've earned that hopefully premium free, and a lot of people take it. So now back to the special enrollment period. What happens at that time is, depending on whether you have Medicare Part A already or you don't, there's processes you have to follow to sign up for Medicare, and you're going to get a form filled out by your employer that's going to show that you've had continuous coverage. So when you submit the application, you're not going to be penalized for not taking Medicare when you turn 65. Now, you'll notice up above, I've also written the letters GEP, a general enrollment period. So what is that? That is for people that missed their IEP and they do not have an SEP. And that is a set time of year every year. That is from January 1st to the end of March. So if you're not in Medicare and you want to be signing up for Medicare Part B, you got to do it during that time period, or you're going to be locked out another year, and you could end up with penalties depending on how long you have not taken Medicare Part B when you were first eligible to take it, if that makes sense. So now what's going to happen is, once you sign up for A and B, you're going to receive a Medicare card in the mail. It's going to have your name on it, a Medicare number that is specific to you. It's going to list your Medicare Part A and Medicare Part B start date. So now you're feeling great. You've taken those steps, but guess what? The work is not done. Now you've got more to think about, and You're going to decide, are you going to go with original Medicare, stay where you are the way you've already signed up, and consider getting a Medicare supplement policy and a Part D prescription drug plan, or are you going to go with Medicare Advantage? So let's talk about this column first. If you stick with original Medicare, your insurer is the Centers for Medicare and Medicaid Services. Medicare does not cover every dollar. So that's why you get a Medicare supplement to help cover the dollar amounts of a Medicare approved claim. And then prescription drug coverage is not covered in A and B. There are some drugs covered under Part B in a medical setting, but the drugs you pick up at a pharmacy, that's under Part D. For both the supplement and Part D, there's going to be typically premiums, and with Part D, you may have deductible, copays, coinsurance. So, and as far as the supplement goes, you're choosing a plan that's going to cover some of the dollar gaps, and you can choose how many gaps you want to cover depending on the plan that you choose. So how do you enroll in a supplement? Of course, you can do it on your own. You can go to your local SHIP, or you can work with an agent, and the agent will help submit the application to the private insurance company for your supplement and for the Part D plan, whichever plan you choose. When it comes to Medicare Advantage, same thing. You could do it on your own. You go to medicare.gov, do all your research, or you can work through an agent and they help you submit the application. Whichever way you go, you want to make sure that when it comes to your prescriptions, you have the names, the dosage, the frequencies, so you make sure you're choosing your most cost-effective plan. If you are considering having an agent help you with this process, you want to reach out early because the agent can help you understand your enrollment options and the timing and help you so that you don't end up with penalties. And then, of course, the agents can help you with this stuff that I just discussed.